All right, everyone. Thank you so much for holding, and welcome again to this Igea Software ICD-10 CM webinar, Preparing for the Transition. My name is Donovan Peralta, and I'm a trainer and customer support supervisor at Igea Software. Today, I would like to offer you a quick snapshot of everything that has been going on with ICD-10 and that big change coming on October 1st. I would also like to assure you that there's nothing to fear. There is plenty of information out there available to you. Also, we have opened a resource page on IgeaSoftware.com in order to keep you up to date with the latest information about this new diagnosis code set and to help on a smooth transition to ICD-10 CM. So let's go ahead and get started. All right, so a couple of things about this webinar. During the presentation, you will be able to ask questions using the chat section on the right-hand side panel of this webinar screen. Then at the end of the webinar, we will take 10 minutes to answer some of those questions that you have submitted. We might not be able to answer them all, but we'll do our best to answer as many as we can. The rest of the questions will be answered via email. All right, so let's review the webinar goals real quick. By the end of this webinar, you should be able to understand the basics of ICD-10 CM, recognize the main differences and similarities between ICD-9 CM and ICD-10 CM, understand the new structure and basic coding process, learn what we as your software vendor will be doing to ensure you are in compliance, and finally, identify the main steps your home health agency needs to take in order to prepare for this transition. All right, so what is ICD-10 CM PCS? ICD-10 is the 10th revision of the International Statistical Classification of Diseases and Related Health Problems, which is a medical classification list by the World Health Organization. As we might know, it codes for diseases, signs and symptoms, abnormal findings, complaints, social circumstances, and external causes of injury or diseases. Work on ICD-10 began in 1983 and was completed in 1992. In the United States, we're implementing a clinical modification of the ICD-10 code set provided by the Centers for Medicare and Medicaid Services, or CMS, and the National Center for Health Statistics, or NCHS, to classify diagnosis and reason for visits in all American healthcare settings. The international version of ICD codes should not be confused with the national clinical modifications. In the United States, for example, ICD-10 CM has approximately 68,000 codes, while the international version only has around 14,000. The U.S. also has ICD-10 PCS, which is a procedure code system not used by other countries, and that contains approximately 87,000 codes. ICD-10 CM will affect diagnosis and inpatient procedure coding for everyone covered by HIPAA, not just those who submit Medicare or Medicaid claims. And if your home health agency is not covered by HIPAA, it's highly recommended that you make the switch, since ICD-9 CM will not be updated or maintained. This change to ICD-10 CM does not affect CPT coding for outpatient procedures, and ICD-10 PCS is for use in inpatient hospital settings in the U.S. only. That means that home health agencies will no longer be required to use procedure coding, which is one of the reasons why some items are being dropped in the new versions of the OASIS assessments and the CMS 485 form that are being implemented on October 1st as well. All right, so some of you might be wondering why this change when we have done so well with ICD-9 CM for the last 36, 37 years. And the answer to your question is that no, we haven't. So why are we making this change? There are plenty of reasons why this switch to ICD-10-CM is needed, but we could summarize them in just a few. First of all, ICD-9 codes provide limited data about patients' medical conditions and hospital inpatient procedures. If you didn't know, the ICD-9 code set was released in 1977, and the U.S. clinical modification was implemented in 1979, which is exactly 35 years ago. That being said, ICD-9-CM no longer reflects current medical treatment and doesn't accurately describe advancements in technologies. Limitations in the coding system translate directly into limitations in coverage and reimbursement. If you can't code accurately, you won't receive an accurate reimbursement either. That's just common sense. So second of all, ICD-10 allows for greater specificity and clarity when it comes to describing a patient's diagnosis and in classifying patient procedures. ICD-10 will implement newly developed diagnoses and procedures, innovations in technology and treatment, performance-based payment systems, and a much more accurate billing. ICD-9 coding will make the billing process more streamlined and efficient. And this will also allow for more precise methods of detecting fraud. And it's good to know also that the U.S. is the last industrialized nation to implement the ICD-10 code set for morbidity. Other countries such as Canada, Germany, France, South Africa, China, Korea, and some others have been using ICD-10 codes for quite a few years now. So we have to recognize that ICD-10-CM is needed. It should have been implemented a long time ago. This is definitely a change for the better that will benefit all of the actors in the healthcare industry. How to stay compliant? Well, by now we should all know that the implementation of ICD-10 has been delayed to October 1st, 2014. So being in compliance means that if you're a HIPAA-covered entity, then you must start using ICD-10 codes as of the first day of October of 2014, which, as we can see on the right-hand side, will take place in exactly 190 days from today. So you better stay ready. Remember that if you do not make this switch and still attempt to submit claims or OASIS assessments with old, obsolete, and outdated ICD-9 codes, you will get an immediate rejection. It's real, it's happening, and the best part is that we do not have a choice. Let's now review on our next slide the implementation guidelines. All right, so there are 3 factors to be considered on claims that span the October 1st date. So the first one is the episode start date. Second is the date the OASIS assessment is being completed. And the third one is the episode end date. This table below will help us better understand the implementation process. So let me explain to you how this is going to work. For home health episodes, the OASIS assessment completion date will determine whether the HIP scope for the episode will use ICD-9 or ICD-10 codes. If completed prior to October 1st, then ICD-9 codes must be used. If completed after October 1st, then ICD-10. Now, when it comes to the claims, the request for anticipated payment or RAP will use ICD-9 or ICD-10 based on the episode start date. So the same rule applies here. If the episode starts prior to October 1st, then ICD-9 codes should be used. If it starts after, then ICD-10. And the same also applies to the final claim. All right, let's review our first example in the table. We have a start of care or resumption of care with an episode start date of 9/28/2014. Since this is happening before the deadline of October 1st, we can see on the right-hand side that ICD-9 CM codes will be used on the RAP. That makes sense. 9/28, ICD-9. Now, let's say that the OASIS assessment is being completed on the 30th of September. And again, that's prior to the deadline. On the right-hand side, we can see that ICD-9 CM codes should be used because the OASIS is being completed before October 1st. Also, the version of the OASIS is going to be the current one, which is the OASIS C. Now, when it comes to the final claim, we can see that the final claim is being completed, or actually being billed, on November of 2014. Obviously, since this is past October 1st, we're going to use ICD-10 codes and the claim. All right, our next example, a research. Okay, the episode start date is 9/28, so ICD-9 codes will be used on that research assessment. Let's say that the OASIS completion date is on 9/25. We know the research is always completed prior to the episode start date. So in this case, ICD-9 codes will be used in the OASIS assessment, and the current version of the OASIS, which is OASIS C, is the one to be used. When it comes to the final claim, we have the same scenario here. Episode through date is 11/26, so ICD-10 codes should be used on that final claim. Notice that for the wrap, we use ICD-9, and for the final claim, ICD-10, just like in the previous scenario. Okay, the third example shows that the start of care or resumption are being completed on the 28th of September prior to the deadline, so obviously ICD-9 codes will be used on the OASIS assessment. All right, but let's say that, well, I'm sorry, that's the wrap actually. So ICD-9 codes will be used on the wrap since the episode start date is prior to the 28th, to the 1st of October. When we go to the OASIS assessment, as you can see, this assessment is being completed on the 2nd of October. Therefore, the new version of the OASIS, which is the C1, will be used, and the ICD-10 codes, which we can see on the right-hand side, will be used on that assessment. And when it comes to the final claim, same scenario here. Final claim is being billed after October 1st. Therefore, ICD-10 codes will be used. In our last example, we have a recertification for an episode that starts on the 2nd of October. On the right-hand side, we can see that ICD-10 codes will be used since it's being completed after October 1st. And then for the OASIS that is being done a few days prior to the deadline, we're going to be using ICD-9 codes. So this is pretty straightforward, as you can see. As long as the items are being built or completed, in the case of the OASIS assessments, prior to the October 1st deadline, we're going to use ICD-9 codes, and if it's being completed after the deadline, then we're going to use ICD-10 codes. Keep in mind that you don't need to remember this when you use Igea HHC or IPOC. The type of codes to be used will be automatically set by our applications. I also want to point out that when the coding of these home health episodes that span the October 1st date is done, both Igea HHC and IPOC will ask you to pick the applicable ICD-9 codes and the respective ICD-10 equivalents. And the reason behind this is that, as we can see in this implementation table, these episodes will require diagnosis in both code sets. So now that we have covered the implementation guidelines, let's take a quick look at the ICD-10-CM coding structure. All right, so on this slide, we can see the main differences between ICD-9 and ICD-10. ICD-10-CM codes have 3 characters before the decimal and up to 4 characters after the decimal. Codes are alphanumeric, with the first character always being a letter. All letters except for the U are used. Letters are not case sensitive. Upper or lower case won't make any difference. All right, now let's review the similarities. When it comes to the tabular list, in both code sets, we're going to have a chronological list of codes divided into chapters based on the body system or condition code. Both code sets have a hierarchical structure. ICD-10-CM chapters are structured similarly to ICD-9-CM, with a few exceptions. A few chapters have been restructured, and the sense organs have been moved from the nervous system chapter to their own chapters. All right, when it comes to the index, in both ICD-9 and ICD-10, we're going to have an alphabetical list of terms and their corresponding codes. Just like ICD-9-CM, indented subterms appear under the main terms in the ICD-10-CM index. The index structure is the same in both code sets, meaning that there's an alphabetic index of diseases and injuries, there's an alphabetic index of external causes, there's a table of neoplasms, and there's a table of drugs and chemicals. All right, we have more similarities. So many conventions have the same meaning, abbreviations, punctuations, symbols, notes, such as code first and use additional code are the same. Just like ICD-9-CM, ICD-10-CM has unspecified codes for use when no information is available to support a more specific code. Codes are looked up in the same way in both ICD-9 and ICD-10. And in both code sets, a code is invalid if it is missing an applicable character. All right, let's now review the main differences. Injuries are grouped by anatomical site rather than by the type of injury in the tabular list. However, you would still look up the term for the type of injury, such as fractures or sprains, in the alphabetic index. ICD-10-CM codes reflect modern medicine and updated medical terminology. The concept of laterality has been added to some chapters, and the use of combination codes has been expanded. There's also a new feature being introduced with ICD-10-CM, and that is the seventh character. A seventh character is used in certain chapters such as musculoskeletal, obstetrics, injuries, and external causes. Seventh characters are also used in a few other places outside of these particular chapters. This seventh character has a different meaning depending on the section where it's being used. Identification of the type of encounter is a circumstance where seventh characters are used. For example, a seventh character identifying whether the encounter is initial, subsequent, or sequela is used in the injury chapter. It must always be used in the seventh character position. And when a seventh character applies, codes missing this character are considered as invalid. All right, another new feature being implemented with ICD-10-CM is the dummy placeholder X, which is used in certain codes to allow for future code expansion or to fill an empty character when a code contains fewer than 6 characters and a 7th character applies. When the placeholder character is applicable, it must be used for the code to be valid. And just like with any other alpha character in ICD-10, the placeholder X is not case sensitive. As an example, we have listed the ICD-10 code that describes a foreign body in the cornea, left eye, initial encounter. Using lower or uppercase X, this case will not make any difference. All right, now let's take a look at an ICD-10-CM coding example. All right, so to code a diagnosis of fracture of proximal third of scaphoid bone, we're going to start by looking up the main term fracture in the alphabetic index, just as we would in ICD-9-CM. So when we look up fracture, traumatic scaphoid hand in the index, there are no sub-entries, and a note directs us to see also fracture carpal navicular. If we look up fracture carpal bone navicular under carpal bone, there is a sub-entry for proximal third displaced with code S62.03 listed. All right, so that's what we have so far, S62.03. Now we need to verify the code by looking it up in the tabular list. So let's move on to our next slide. So when we look up S62.03 in the tabular, we first notice two notes under S62 stating that a fracture not indicated as displaced or non-displaced should be coded to displaced, and that a fracture not indicated as open or closed should be coded to closed. Also, we can see that there are 7 characters that apply to the S62 code, and we get the actual characters with the respective description as well. So from this list, we're going to grab the first code, the first one for an initial encounter. That's going to be the letter A for initial encounter for closed fracture. We're still missing character number 6, so let's jump onto our next slide. All right, so as seen here, there are more characters to the correct code assignment than the 5 characters initially shown in the index. The correct code for an initial encounter for a traumatic fracture of the proximal third of the scaphoid bone for the left wrist is S62.032, which is displaced fracture of proximal third of navicular scaphoid bone of the left wrist. And that will complete our code assignment. So it's good to know that although the documentation of the diagnosis did not indicate whether this fracture was displaced or non-displaced or open or closed, per the instructional notes under S62 coded it as displaced and closed. Okay, so let's now take a look at the changes Igea Software will be implemented in the next few months. As of October 1st, 2014, both Igea HHC and IPOC will include, first of all, a built-in general equivalence mapping tool. And this tool will allow you to convert any code from ICD9 to ICD10. This is what we know as forward mapping. As an example, we have the ICD9 code A20.02 for a fracture of mid-cervical section of femur closed. So we will see that this code has 2 ICD-10 equivalents. This is a test that will be performed by our GEMS tool. And from here, you would just need to select the code that best describes the patient's condition. We haven't yet decided whether the backward mapping, and that is the conversion from ICD-10 to ICD-9, will be implemented in our software. This is a feature that you might not need to use, but anyway, based on the feedback that we receive from you, we will determine whether we need to implement it or not. Keep an eye on our website, igea.com and IgeaSoftware.com, for a poll that we will be posting on our website pretty soon. As another cool feature being implemented in both IPOC and Igea HHC is an alternate drill-down search for ICD-10 diagnosis codes. This image on the right-hand side illustrates what this option will look like. We can search for diagnosis codes, chapters, or terms in the index. When we click each chapter or term, it will display the different entries and sub-entries that are contained within each one. And as we keep on clicking the different items, we're going to keep digging deeper and deeper into the index until we find the exact code that we're looking for. So this is a pretty cool feature that will be implemented in both Igea and IPOC, and that will allow us to get those specific codes that we need, whether it's ICD-9 or ICD-10. Remember that for those episodes that span the October 1st date, you're going to have to use both codes, and therefore both Igea and IPOC will assist you in selecting the specific ICD-9 codes and their respective equivalents in ICD-10. All right, so there's more features that we are going to be implementing as of October 1st, and that also includes a new OASIS C1, the different assessments, different OASIS C1 assessments, and also an updated CMS 485 form. As we already know, CMS has made some changes to the OASIS assessments to accommodate the new ICD-10 codes. Some items have been deleted and some others have been added. These new forms will be available in our software as of October 1st of 2014. Also, changes are expected to be made in the CMS 485. We haven't confirmed that yet, but if once ICD-10 is implemented, we also expect changes to be made in that form, since the procedure codes will no longer be used. The OASIS assessments, we know for sure that some items will be deleted. That includes item N1012 for the inpatient procedures that will be deleted in both the start of care and the resumption of care. Items N1310, 1312, and 1314, which report the length, width, and depth of the largest pressure ulcer, will also be deleted in start of care and resumption of care assessments. M1350 will also be deleted along with M1410, 2010, and 2440. All right, so now that we know what changes are being implemented in ICD-10 with the transition to ICD-10, let's take a look at what you can do as a home health agency to make sure that you're ready for this transition. All right, so identify staff training needs. Training is a critical step for ensuring that staff is knowledgeable about the ICD-10 CM code set and prepared for using the new codes appropriately. Different staff within your agency may require different training based on their involvement with the diagnosis codes. Training should focus on learning the ICD-10 code set and any workflow changes. Remember that clinical staff will need to learn about ICD-10 CM to understand how their documentation will impact the ability to code and bill. Your coding staff will need the most training to learn how to use the new code set and correctly capture the diagnosis using ICD-10 CM. All right, improve clinical documentation. Keep in mind that the increased specificity of the ICD-10 CM codes requires more detailed clinical documentation in order to code the diagnosis to the highest level of specificity. Again, you need to make sure that your caregivers receive the proper training to meet the exactness required by ICD-10 CM. Also, we advise home health agencies to review their clinical notes to ensure that they do reflect the specificity of the ICD-10 code sets, and for your caregivers to document the patient's conditions with the highest level of accuracy. We also advise agencies to buy the ICD-10 CM manual, which includes the alphabetic index and the tabular list, and to watch online ICD-10 CM tutorials and webinars. So we have listed some resources that we highly recommend that you go ahead and review with important information about this new code set. All right, everyone, so we have reached the end of our ICD-10 CM presentation. So what we're going to do now is take the next 10 minutes to answer some of the questions that have been submitted. If we don't have enough time to answer your question, you will receive the response later on via email. All right, guys, thank you so much for holding. So let's start with the first question. Can we start coding ICD-10 before October 1st? The answer to that question is no. Remember that CMS and all its fiscal intermediaries will not be able to process claims using ICD-10 before the October 1st, 2014 date. However, we will ask you to code OASIS with ICD-9 and ICD-10 for the overlapping episodes and instances mentioned previously in the presentation. All right, so let's look at our second question. Does the OASIS C1 support ICD-9? Remember that because of the implementation date of the OASIS C1 on October 1st and the implementation of ICD-10, Igea will choose the OASIS type based on the Moon ID date, and there will never be a situation in which you need to use ICD-9 with OASIS C1 types. Nevertheless, because of the overlapping with the billing transmission in the transition phase explained earlier, you will be entering both codes in ICD, codes in both code sets, in both ICD-9 and ICD-10. All right, the next question says, should coders increase their knowledge of anatomy for ICD-10? Well, coders would greatly benefit from additional knowledge of anatomy and physiology. The general diagnosis codes in ICD9-CM are replaced with ICD-10-CM. And remember that these codes indicate the side of the body that is affected. That's what we know as laterality. And often the specific body part involved in the diagnosis. Therefore, coders need to be familiar, definitely, with this new code set. All right, so how are CPT and HCPCS codes affected? Okay, keep in mind that current procedural terminology, or CPT, and Healthcare Common Procedure Coding System, or HCPCS, are not part of this transition, and they will remain the same. The grouper for the HIPS code in the OASIS assessments will be updated in order to incorporate the new code set, but the case mixes will remain the same. Okay, someone else asked if there's going to be an additional cost for the ICD-10 GEMS tool that we're implementing in Igea. And the answer is no. Remember that Igea Software, as part of our commitment to our customers, we keep our systems updated to support all CMS and industry mandated updates. We did it when we had the outlier cap and for the therapy requirements, and we will do it again this time with ICD-10-CM. So keep in mind that no additional cost will affect this implementation of ICD-10 in Igea. Okay, another question that I have here, are billers going to have to re-enter ICD-10 codes in the claims? Okay, the answer to that is no. Remember that coders in the agency, at the time of doing the assessment, will add the codes. Do we need to submit ICD-10 test submissions? Okay, no. The answer is no. We will test the ICD-10, and we're going to do all that testing on our end. Our clients do not need to worry about any test submissions. Keep in mind that we have you covered with ICD-10-CM. When it comes to our applications, that's going to be both IPOC and Igea HHC will be updated appropriately to reflect the changes coming on October 1st. So no need to worry. Okay, can we have a copy of the slide? So yeah, we're going to be uploading a PDF copy of the presentation to our website. So you should be able to download it from there. We're going to post a link on myigea.com, and it'll be also available from the IgeaSoftware.com website. Okay, is there going to be another webinar like this? All right, so yeah, the answer is that we do provide webinars as needed. If there's a comprehensive change in the industry, we will be happy to keep our clients informed. I'm not sure if there's going to be another ICD-10-CM webinar, though. If our clients continue to have questions about it, we will certainly consider doing another one. Remember that you can always email us requesting additional webinars to support@endursystems.com. All right, so that's all the questions that I received so far. Remember, support@endursystems.com if you have any additional questions. I want to thank everyone for attending this webinar, and keep an eye on our website for upcoming webinars if needed. Okay. So thank you again, everyone, for attending. We have reached the end of our webinar. You have a great day, and thank you for choosing Igea Software.